Hey, Matt Sitter here, CEO of AFN. At AFN, one of our fundamental beliefs is that change is where opportunity happens. And the best way to take advantage of opportunities that come about by change is a network that is diverse in experience, expertise, and perspective. What we do on a regular basis is we bring subject matter experts together for our network to be able to learn from. Today, we've got Greg Cangialosi with us. Greg's a serial entrepreneur, former managing partner of Olive Ventures, now CEO of Twilight Technologies. He's an investor, passionate music fan, as well as plays a little bit too, and he's a squash player. And we're going to talk a lot about Greg's most recent launch of his company, but a lot about his career as well. Greg, good to see you.
Thanks, Matt. It's great to be here. Appreciate you having me on today.
100%. Okay, so first and foremost, you just had your launch of Twilight. Why don't you tell us a little bit about what Twilight is, and then we'll get into how you actually started building it out and what your thought process was around that.
Yeah, sure. So Twilight Technologies is a healthcare technology in the age tech space, which is we launched to build solutions for the aging population and their caregivers. And our first product is called the Illuminator, which brings vital, complex healthcare information together in an easy to understand format for not only both Medicare members, but their caregivers. We think the problem is pervasive in the US. It's growing. We're under-equipped. There's a lack of technical infrastructure. And so that was sort of the original vision of the company, to go after this problem.
So I agree 100%. Demographically, I think that this problem is going to grow. What drove you to recognize and then subsequently pursue this? Why did this end up being a passion for you?
Yeah, no, thanks for the question. The why for me came from, as you know, a personal experience, becoming a caregiver for my mom early in 2022, actually in January. And having to, before I really even understood what was unfolding in front of my eyes, I was managing multiple chronic diseases. I was navigating a move from New Jersey down to Baltimore. I was managing the diagnosis of another cognitive chronic disease, selling real estate, assisted living transition. And then, as I call it, the initial really big peak of caregiving was what I was absorbed to, and then absorbing and at the same time processing all this and navigating it while doing all the other aspects of life, which you could imagine is just overwhelming. And so I just could not believe how difficult it was to try to get a full picture of what was going on with my mom from 3 hours away. Like, I had no idea who her doctors were. I didn't know what medication she was on. I really, outside of knowing she was diabetic, didn't know much about her health care. And so that was the thing that drove me to say, let's look at this problem a little bit deeper and see if we can build some solutions to help, like, literally at the low hanging fruit level of this.
Well, there's an incredible amount of stress that comes along with not understanding that as well.
Increased stress, lack of confidence. You're suddenly in charge, at least in my case, of someone's well-being in life, and not knowing much about their healthcare. I mean, how could you really do that and feel confident about it? So, yeah, there's a lot of benefits to having just the basics.
So you're a relative, and I like age tech. I had not heard that used as a term before, so I'm going to start using that.
That's the term.
But you are a relative newcomer into the healthcare space. Right?
That's right.
You've been a serial entrepreneur. You've done all sorts of different stuff.
Yep.
When you were at Olive, you got exposed to all sorts of different types of healthcare companies that were just getting rolling. How did that experience inform what you're doing now?
It was, looking back on it, it was definitely like the boot camp, when Sean Lane recruited me in and said, I want you to run Olive Ventures, launch the venture studio. I said, Sean, I don't know anything about healthcare. He said, don't worry, you can learn it. You know enough about a startup. So I think my experience at Olive really exposed me to the state of our healthcare industry in the US. Always just really looking at it from a consumer's point of view. It was really interesting to get sort of a view behind the curtain, so to speak, on how a lot of things work from the payer side, the provider side, regulation. I just sort of got like a blitz of like 2 years of healthcare.
So, state of the healthcare industry, right? You're getting an outside view on that. Anything that you would say, you found opportunity in this, right? So maybe that gave you some confidence saying like, hey, I'm experiencing this. I can help create a solution around this. What's your general assessment of what the healthcare industry looks like in the US? Any little nuggets that you can give us from that experience?
I just think generally, we have a lot of problems. We've got a lot of unaligned and misaligned incentives. Just the whole thing's a mess. I think it's too much to go into in terms of saying what's wrong with it particularly, but there's just a lot of problems in it, and a lot of misaligned incentives. And most often than not, I've found, like many, that the patient is the last one who's the priority. And so I think that's what we got to fix. And I'm not saying there's not efforts that have started to do that. We're getting there, but there's a long way to go.
For sure, for sure. So your approach for Twilight and for the Illuminator specifically was to be really efficient. And this is one of the things that has impressed me so much as you were thinking about like how you're building the company. What were some of the guiding principles that you used in terms of like driving efficiency to be able to get a product up and running as quickly and as effectively as you did?
Well, I mean, listen, this is where the magic of amazing people come into play here. Through my work at Olive, I got to meet many incredible individuals. One is Justin Shaper, who's here on the call with us today, who's our CTO. And Justin has, don't quote me here, Justin, but I know at least 25 years plus of claims data working with healthcare data in general and healthcare technology. So right off the bat, when we were thinking about this solution sort of together, what could we come up with that would didn't feel like it was boiling the ocean, didn't tie us to any particular chronic disease or geography. It was Justin who said, let's see if we can paint a picture of somebody using just the claims data from their past. And so that was really, I think, a big jumpstart in the direction we took. And then again, more of the same amazing connections through my experience at Olive led me to just an amazing product team that's worked together on several projects. And so I just think the speed and the efficiency of those things combined, plus I think everybody involved in the project generally understands what we're trying to do and that this is something that is going to help people.
Okay. So, I mean, a couple of things that I'm taking away from that. So it seems like virtually everyone that you've had involved so far, you've already come across in your life in some way, right? That they were part of your existing network. Is that fair?
This particular run through here is really a lot of the Olive network. Like I said, Justin and I met through Olive. Actually, Olive ended up acquiring the company that he was working for, and through a bunch of moves, he ended up working in our venture studio and providing guidance to our portfolio companies before joining one of them. And so that's how we met. And then actually the other company that I got connected to our product team was also acquired by Olive. So a lot of good things came through the Olive experience for me, not only the knowledge of healthcare, but also just meeting all these incredible people.
Well, and I think one of the other things that stood out to me is the people that you've got involved, they can all have a passion for what's going on because they can understand either they're experiencing being a caregiver or they know that they're going to have someone caring for them at some point or things like that. How do you guys collectively talk about that personal connection?
Well, I mean, I like to say that I don't think there's more than 1 or 2 degrees of separation between anybody probably on this webinar and that we know before they touch or reach somebody who's dealing with a caregiving situation or knows somebody who's living a caregiving situation. So it really is that pervasive. I think everyone understands from an empathetic perspective how difficult this can be. And I just think collectively, we all just know that we're working towards doing something good that will help others navigate this journey just a little bit easier with a little more confidence. And that's really the goal of the Illuminator, among many others. We hope to have impact across the board in other areas we can talk about. But I always like to say to the folks, if we can just increase somebody's confidence and lower their stress level and put them in a position where they can advocate properly with the right knowledge for the loved one that they're caring for, we've won already if we do that once.
Excellent. Excellent. Well, a couple of times you've talked about claims data
Yeah.
as we've been discussing things. And at one point, I was in charge of reimbursement at a thyroid cancer diagnostics company, and I always talked about reimbursement as being the dark art and logic-free zone of healthcare. But you're looking at claims, like there's a ton of data that's being pushed out there through claims. How did you recognize that as being, a spot where you could actually wring really good information out to help us deduce what's going on with the patient?
Yeah, I think, I'm going to once again point to Justin's incredible career working with healthcare data and particularly with claims data. So when we looked at sort of what comes through a claim, and we look at now that we have some sort of standardization of data formats, HL7 and FHIR, and we know that's going to be growing. Obviously, it's the standard now. It turns out that the little bits of information, and I'll call them little, there's actually a lot. You can generate a pretty accurate narrative when you take things like ICD-10 codes, i.e. diagnoses codes, service codes, et cetera, all the things that correlate to how to get paid for providing medical services and healthcare services to someone. And all the other metadata that goes along with that, you can paint a pretty good picture, albeit it all has happened in the past. You can paint a pretty good picture of what's going on or what has gone on with somebody, and where like the areas of attention that may be needed stand out clearly.
Medicare is just a massive beast, right? The number of claims that are going on every day.
Yep.
And I know that you were able to, start actually being able to work directly with the claims data pretty darn quickly. Do you have any sense on how Medicare is thinking about the problem that you're trying to solve here? Is there any insight?
No, I mean, yeah, it was really interesting. Just to go back, we started the prototype, and Justin could talk about it too. Is we literally started this off downloading a text file out of my mom's portal. Once I said, "Mom, can I use your data? I think we're onto something here." She said, "Any way I can help," right? And so we started with this text file, 36 months, and we got to prototype pretty quickly. Justin had created this new data model that outlined: can we extract doctors? Can we extract medications? Can we extract conditions/diagnoses, both acute and chronic, et cetera? What kind of medical equipment? What kind of services? All these things we started extracting out of Medicare. And then the thing that was actually turned out to be a blessing was that Medicare around May or June of last year stopped the ability for anybody to download claims. So our data source effectively was shut off. Now, one would think, well, that stinks. But at the time, it was a blessing, because what it did is it made us move quicker to integrate with the Blue Button API, which is CMS's and Medicare's API for claims data. And to get to your question, we had gone through this, and I really was expecting sort of like a 3 to 4 month process. We're integrating with the federal government, never done this before. And we actually wound up going through the process relatively quickly. I think all in it was less than 6 weeks. What was really exciting to me was when we were going through our use case for why we wanted access to the API, the Medicare team, at least the team, really understood our use case and was excited that there was thinking that there could be a lot of use for caregivers with claims data, especially the stuff that they were publishing. So we're excited about how far we've gone with that data, and we're really excited to connect with that team again. We're going to be doing a demo with them at the end of the month, just to show them kind of what we're up to and show them what we're doing with the data. And they're an innovative group, and so we look forward to future enhancements on what else we could do with it as we progress forward.
Very cool. The initial thesis around the company was largely having to do with caregivers and being able to help them be confident around what's going on. And
That's right.
as the Illuminator is now out in the wild, right?
Yeah.
And getting people giving you feedback. One of the things that you and I have talked about is you're learning that some of these people who are in the Medicare population, who we usually assume are less tech savvy or, less able to use these tools, are actually saying like, hey, this is useful for me. Tell us a little bit about what you've learned about how different populations are capable of using information in the way that you are packaging it out.
I think probably the biggest challenge I've had, one of the bigger challenges we've had is how do we position this particular, at least MVP, um, to be useful not only to Medicare members. So if you think about the age, right, 65 and older for Medicare, and then you think about the caregiver, right? I don't know about you, but I mean, I know plenty of people over the age of 65 who are technically rocking and rolling. So we've had to try to build something that spoke not only to the Medicare member themselves, but also enabled the caregiver to come and get up to speed quickly if needed. So we basically designed this for 65 to 85-year-olds who, in various degrees of ability to get in and do, you need your Medicare.gov credentials to provide the consent to share the data. And that really is where the magic happens. But we've got a handful of users who are on Medicare. And so for those folks, we built this so that they have control over their own health data. They know who their doctors are. They know their contact information. They know their medications. They know all the things that we have on our platform, and they can then choose to share that with their family, their caregivers, when the time comes or as needed. And the way we've architected this is to set up different levels of sort of information sharing. You know, you may need a monthly or a quarterly digest or of what happened with somebody, or you may want to be alerted if there's urgent care visits or a change in medication. We have all sorts of things that we've built out. Plus, we want to hear from other folks. But for the caregiver themselves, and you know, it's going to be hard to throw an age range on that. I'm 50 myself. I became a caregiver when I was 47. But I know people who are 40 doing this as well. We built it really for folks to be able to preemptively track the health journey. Sort of think of it as like Doppler radar for the aging population. That's the analogy I like to use. You can kind of see maybe where the dark, stormy, cloudy weather is coming in based on the things you're seeing. To put that into like a real use case, from my own experience, when I intervened with my mom's situation, it was January of 22. Had I had the illuminator, and it was also January 22 when I realized the reason she was walking with a cane for the last 6 or 7 months was because her Achilles tendon was torn. I would have found that out in July. And I don't know a lot, Matt, but I know the Achilles tendon is sort of like, you know, something you need.
It's a big deal. Yeah.
Her solution was, at the time, I didn't realize it, not knowing, she couldn't figure it out. She didn't know how to navigate it. She was going to orthopedics. Her A1C was through the roof. She was really sort of not having a good time, she wasn't in a good state of mind at that point in time. So I really, you know, I could have intervened and probably done a bunch of things, prevented a bunch of things from happening had I had something like this. So, you know, from a caregiver perspective, I don't know what that age range is, but anybody who's looking after an elderly person or a loved one who has a partner that they need to keep track of, we've built this with that kind of utility in mind. Ideally, I think both Justin and I would like to say we'd love people to use this preemptively, like I said, so you're prepared for a moment. But if you are in a situation, which I call the OSHIT situation, and you need all this data, which you will, you can get it very quickly, at least up to and what was processed last through Medicare. And you'll need that information probably 25 times again. If you're doing a transition like I did.
100%. And I think when you're talking about your mom, the surprising thing is that there wasn't really a quarterback for her care, right? You know, the expectation was that it was going to be her. And at
her PCP retired. I mean, it was like I was fishing from Baltimore to New Jersey, hearing the words like fax multiple times and leave a message. And why, it just was very, I would say probably delayed me setting up all new healthcare for her effectively for at least 3 months down here in Baltimore, just based on the delay of, you know, not having this information.
Right. Well, and for some people, those 3 months matter a whole heck of a lot.
Big time. Yes.
Earlier you catch some of the stuff, less damage is going to be done.
Totally. I mean, I think, you know, not to babble on, but I mean, the impact areas really are, you're going to have, I would hope that if we were sitting back here having this conversation 2 years from now, we could say, you know, we impacted in a couple areas. We impact with better health outcomes, right? Because there's a continuity of care, informed decision making, all these types of things. Um, what's my other big one? That would definitely like lower the cost of care, right? Because if you're doing that, you're going to obviously save dollars because you've got, an informed advocate network around somebody. And then, like I said, from the caregiver perspective, if we can lower stress level 10% and or increase confidence by 10%, that's another big impact. So I just think, it touches patients, caregivers, and the actual healthcare system itself. So we'll see where it goes.
I mean, just talking about the stress, I've heard a number of times, top reason for people to file bankruptcy in this country is around medical costs, right? So you've got the stress of actually understanding what's wrong with someone on top of the amount of money that it can end up costing. If it's possible to make the system less burdened, I think that that's amazing.
Yeah. I think it's still like, at least the last time I checked, it was like the number 3 highest form of debt in the country was medical debt, which is really sad when you think about it, right? Going back to what's the state of affairs for, that's one of the problems.
Right. So one of the things that, as I've seen the Illuminator, I've just been impressed. It's a pretty product. There's beauty that was designed into it. If you can tell us just a little bit about some of the design principles that you put in place, and maybe if you contextualize that against who you think was going to be the users of this as well.
Yeah, that's a great question. I actually really enjoyed that process the most too. And first of all, I just want to give a big shout out to Cassie Huck, who is the UI UX designer for all things Twilight, from the website down to every almost pixel you see on the web interface of the platform. It was really interesting too, because the other thing that we did that was different about this from a design and a UI perspective for the company was we started with the UI first before we even thought about what Twilight was and what it looked like or any of that. Like the whole idea was like, and it was actually just to put a point in time a year ago, probably this week or within 2 weeks, that Cassie and I had met for the first time. We'd meet up at a market in Baltimore, and she just did her best extracting the vision of what I was trying to do, which was, I just visualized something that takes this really kind of like mundane and gibberish, not user-friendly language, that transforms it into an easy to understand format, not only from a navigation standpoint. We use things like conditions versus diagnoses, right? Health providers versus just providers, just little adding contextual things that make it a little more user friendly. And then seeing like the care graph that we design. How do you design visually a view of somebody's like entire health journey based on the peaks and valleys of their care activity? We thought through that, and there's many other people involved by Cassie she really did extract the vision of what I was trying to put out there, which was an application that wasn't intimidating, felt comfortable to be in. Certainly the color palette and UI were a big part of that. Not feeling overly medical or healthcare, not a portal like not there's anything wrong with them, but just not very, healthcare system portally. And then the way we've used the implementation of AI in this, and I was just saying, I put something out online. It's interesting to say we're not an AI company first in 2024. I think we're a human AI company for sure, because with the magic of the data transform that Justin has created with a transform of the Medicare data, we then have a solid set of data that we have trust in, that we can then define different elements of it using AI as a simple translation layer. What is this medication? What is it for? What are the side effects? Boom, boom, boom. And then we append our stuff. Here's who prescribed it. Here's the last people that filled it, et cetera. So it's been really interesting to go through that experience as well, from a design principle standpoint, and just saying like, let's make this approachable for everybody.
Mm-hmm. Yeah, I mean, even the way that you talked about AI is just like, okay, we're going to figure out how to make AI use pragmatic here. This is going to solve a very practical problem that we're thinking about.
Yeah, I mean, we can also thank AI for being why we're live now, because in just remembers, I caught myself going down the AI rabbit hole with trying to one of our early pilots was we were doing these illumination reports for people. They would give us the claims data. We'd do our thing to it. And then we were using AI prompts to try to generate narratives. And it was like Greg with this mad scientist and his beard out to here, like trying to come up with 3-month patient narratives. And then finally, a good friend of mine, Chris Sleet, who runs a venture studio, just said, why isn't this thing live behind a paywall now already? I'm just wondering. And I was like, because I'm trying to write a patient narrative that's accurate. It's like, but you might be the only one that cares about that. And so, which is true, or maybe true, but nonetheless, it was very clear that we had enough to go. Like, it was just, let's get this thing moving. Let's get it moving now.
Yeah, there's value to be realized.
So, but the AI kind of the backdoor shift down was just to use it as that translation layer, which has worked beautifully for us.
So not your first rodeo in terms of founding a company, but I'm sure there's been some surprises along the way. Anything that surprised you on this part of the journey that you'd like to share?
I don't know if it's surprise really. I just think it's more of like a acknowledgement of the gratefulness I have for being on the journey. And for almost every single person that's been involved in it so far, and hearing it, including yourself and everyone at AFN, of course, my team, of course, Justin, everybody who's touched the project is just been a blessing to work with. And I really truly feel understands what we're doing. And so it makes it just that much more fun from a surprise perspective. I think I don't want to say anything that'll jinx us, but it's going pretty smoothly. I mean, once we got out of the rabbit hole of AI, this team really started working on this in November. And so November to here we are. I mean, it's a blessing. So I'm just grateful to be working with such great people.
Well, when someone's doing what they're supposed to be doing, you can just see it. And I strongly believe that you're doing what you're supposed to be doing here.
Well, thanks, Matt. I appreciate it.
The
Thanks for allowing me to talk about it with the group.
This is something important for all of us. And again, this is something that the usefulness to so many different people that are out there. I am going to be very surprised if there is not a tidal wave that you are trying to fight back the number of users very soon.
Well, we will see. Next week could be a very big week for us.
Awesome. All right. So that was a half hour. Thanks so much, Greg, for that discussion. I know that people are going to enjoy listening to this.